Did you know pancreatic cancer takes more senior lives every year than colon cancer? And yet, almost nobody over 60 has ever been warned about its early warning signs. Here's what makes this disease so dangerous: the symptoms actually appear months before it becomes untreatable. Months! Right now, somewhere, these signs are showing up in people sitting in their own living rooms, telling themselves they just need more rest, or that their back is acting up again, or that their stomach has just been off lately. In fact, there's a strong chance that you, watching this right now, have already noticed at least one of the 8 symptoms I'm about to walk you through and brushed it off as something else entirely. What you're about to hear is something most seniors never hear from their own physician. Here's the truth nobody says out loud. Pancreatic cancer doesn't have an 11% survival rate because it's untreatable. It has an 11% survival rate because it's almost always caught too late. Stay with me through all 8 symptoms, especially symptom 5. That one rarely makes it onto any list handed to senior patients, but it should be at the very top. Everything I show you today builds toward it. Before we get into the list, you need to understand why this disease is uniquely dangerous for people over 60. Your pancreas can't be felt during a routine exam. It sits deep inside your body, out of reach, and your annual blood work typically won't catch this cancer until it's already spread. That's not a gap in the system. That's precisely why this disease succeeds so often. It disguises itself as ordinary aging. Here are the 8 signals it leaves behind while it's still treatable. Pay close attention to each one. Symptom 1, urine that keeps darkening, then clearing, then darkening again. Most people notice this and do exactly one thing: drink more water. The color lightens for a day, they assume the issue resolved, and they move on. That assumption is exactly what allows this disease to progress unnoticed. Here's the mechanism. Your pancreas sits right next to the bile duct, the tube that carries bilirubin from your liver into your intestines. Bilirubin is what gives urine its normal pale color and stool its normal brown color. When a tumor forms in the head of the pancreas, it presses against this duct and blocks it. Bilirubin can no longer flow where it should, so it backs up into your bloodstream, and your kidneys try to flush the excess out through your urine. That's why the urine turns dark yellow, sometimes brown, sometimes the color of strong tea or cola. The detail that separates this from simple dehydration is that it returns. You drink water, it lightens, and the very next day it's dark again, because the blockage hasn't gone anywhere. Water can't fix a tumor. This symptom typically shows up before almost anything else on this list, and most people dismiss it 3 or 4 times before ever mentioning it to a doctor. If your urine has been cycling between dark and normal for more than 2 weeks, no matter how much water you're drinking, that's not hydration. That's a conversation to have with your doctor this week, not next month. Symptom 2, abdominal pain your doctor may have already misdiagnosed. This one is more dangerous than the first because your doctor may have already seen it and given it the wrong name entirely: arthritis, a pulled muscle, an old injury, acid reflux, sometimes all 4. And while the wrong thing gets treated, the real problem buys itself more time. Pancreatic pain has a distinct signature. It begins as a dull, persistent ache in the upper abdomen, not the lower belly, not the sides, but right below the breastbone or slightly to the left. And it doesn't stay put. It wraps around the torso and settles into the middle of the back, creating a sensation patients often describe as a tightening band. That happens because the pancreas sits within one of the densest nerve networks in the body. As a tumor grows, it presses into those nerves and the surrounding tissue, sending pain signals radiating outward. 3 details separate this from ordinary back pain. First, it worsens noticeably 30 to 60 minutes after eating. Second, it worsens when lying flat, which is why many people with this symptom end up sleeping upright in a recliner without understanding why. Third, it doesn't respond to the usual remedies: ibuprofen, a heating pad, rest. None of it changes the pattern because you're treating a symptom, not the cause. If this sounds familiar, stop assuming it's your back. Tell your doctor specifically upper abdominal pain that radiates to the back and worsens after meals and while lying flat. Those four details together change the entire direction of a diagnosis. Symptom 3, feeling full after just a few bites. This one is worse than the first two combined because it's quietly starving your body while you sit at your own dinner table. You sit down to eat, a few bites in, and you're done. You tell yourself your appetite just isn't what it used to be. It isn't your appetite. It's a tumor physically pressing against your stomach from behind. As a pancreatic tumor grows, it expands beyond the pancreas and presses on nearby organs, including the stomach, which sits directly in front of it. That pressure reduces your stomach's effective capacity. At the same time, the tumor disrupts the pancreas's ability to produce digestive enzymes, so food sits undigested far longer than normal. Your stomach stays full, your brain reads that as not hungry, and you stop eating. That's how unintentional weight loss begins, and it accelerates quickly because your body also isn't absorbing nutrients properly. Losing more than 5% of your body weight over 2 to 3 months without trying is one of the more serious warning signs in medicine. If you've dropped 10 or 15 pounds without changing your diet, that's not good luck. That's a red flag. In over 2 decades of practice, I've noticed one symptom that appears in nearly every advanced stage case I've treated, and it's almost always ignored. I'll show you exactly what it is before this video ends, but first, the next 4 symptoms complete the picture, starting with one that may already be visible on your skin right now. Symptom 4, yellowing skin and eyes plus unexplained itching. Jaundice occurs when bilirubin builds up so heavily in the bloodstream that it begins depositing into tissue. Skin takes on a yellow tint, and the whites of the eyes turn yellow too. In people with darker skin tones, it often shows most clearly in the eyes and palms. There's a companion symptom almost nobody warns you about: relentless itching all over the body, with no rash and no relief from lotion or antihistamines. That happens because bilirubin deposits irritate nerve endings directly, and it won't stop until the underlying blockage is treated. Here's the dangerous part for seniors specifically. This kind of jaundice looks identical to jaundice from gallstones. Same yellow tint, same dark urine, same itching. And because gallstones are so common after 60, this is exactly where misdiagnosis happens. A doctor sees jaundice, suspects gallstones, orders initial testing, and deeper investigation gets delayed for weeks or months. That's why you can't just tell your doctor, "I look yellow." Bring the whole picture: dark urine, upper abdominal pain radiating to the back, feeling full after a few bites, and now yellowing skin or eyes. Together, that combination tells an entirely different story. Don't let any one symptom get evaluated in isolation. If you haven't already, subscribe now, because symptom 5 is the one that has landed seniors in the emergency room with a life-threatening event before anyone connected it back to the pancreas. Symptom 5, an unexplained blood clot. Think about whether you or someone you know has had a blood clot recently with no obvious cause, no surgery, no long flight, nothing anyone could point to. What I'm about to tell you may completely change how you interpret that clot. Pancreatic cancer releases specific proteins into the bloodstream that alter how blood clots, making it abnormally prone to clotting where it shouldn't. The most common location is the deep veins of the legs. A calf or thigh swells, feels warm, and aches with a heavy, dull pressure that doesn't improve with elevation or rest. Here's where it turns life-threatening. A piece of that clot can break loose and travel to the lungs. Sudden shortness of breath, sharp chest pain that worsens with breathing, and a heart rate that spikes without warning. If those 3 happen together, call emergency services immediately. Not your regular doctor, emergency services. Research has found that in a meaningful number of pancreatic cancer cases, an unexplained blood clot was the very first sign something was wrong, sometimes appearing up to 6 months before diagnosis. 6 months of lead time that's often missed simply because nobody connected the clot to the pancreas. If you've had an unexplained blood clot recently, ask your doctor directly whether abdominal imaging should be considered, not out of panic, but as a responsible next step. Symptom 6, fevers that keep cycling back. This is one your body may already be sending on a recurring schedule, and each time it's easy to explain away incorrectly. A fever appears, disappears, then returns days later. It's tempting to assume it's, quote, a bug going around, but a bug resolves. This keeps returning because the immune system isn't fighting off a simple infection, it's reacting to ongoing inflammation that isn't going anywhere. Pancreatic cancer creates constant inflammation. The pancreas is irritated, the bile duct is blocked, bile leaks into places it shouldn't, and the immune system responds to all of it at once. The result is a pattern of low-grade fevers that cycle in and out without ever fully resolving, often paired with sudden chills, even in a warm room, followed by a mild temperature rise, maybe 99 or 100 degrees Fahrenheit. Then it passes, only to return a few days later. That cycling pattern, especially alongside night sweats that leave you waking up damp without feeling overheated, deserves deeper investigation, not just a prescription for the fever itself. Symptom 7, exhaustion that sleep never fixes. This is the symptom that quietly accelerates everything else on the list while it gets brushed off as ordinary tiredness. You sleep 9 hours and wake up drained anyway. Normal tiredness has an identifiable cause: poor sleep, a demanding day, stress, and a solution: rest. Cancer-related fatigue doesn't respond to rest at all. You nap all afternoon and stand up feeling exactly as heavy as before. Simple tasks, walking to the mailbox, carrying groceries, climbing a flight of stairs, suddenly take a disproportionate amount of effort. Cancer cells compete directly with healthy cells for glucose and nutrients. While your organs, muscles, and brain are trying to run on their normal fuel supply, the cancer is intercepting it for its own growth. The result is an exhaustion that feels categorically different, heavier, more total, and unresponsive to any amount of rest. If that description matches how you felt for weeks, it deserves investigation, not acceptance. Symptom 8, the one I mentioned earlier, the one almost nobody talks about. This is the symptom I've personally seen in nearly every advanced stage patient I've treated, and it shows up somewhere most people never think to check: the bathroom. Your pancreas produces enzymes that break down fat. When a tumor blocks the pancreatic duct, those enzymes never reach the small intestine, so dietary fat passes through undigested, and that changes your stool in specific, recognizable ways. It turns pale, almost gray or clay-colored, becomes greasy with a visible oily sheen, floats instead of sinking, and carries an unusually foul odor. This isn't something you ate. It's a direct mechanical signal that a tumor is interfering with pancreatic function. Alongside it often comes nausea after fatty or rich meals, sometimes vomiting, and a heavy, uncomfortable feeling after eating. Because fat isn't being absorbed, neither are the vitamins that depend on it, which accelerates both the weight loss and the fatigue. Pale, greasy, floating, foul-smelling stool that persists more than 2 weeks warrants a call to your doctor within 24 hours. Not next week, tomorrow. What to do in the next 24 hours? If you recognized even 2 of these 8 symptoms, your next move may be the most important health decision you make this year. Pancreatic cancer isn't a death sentence when caught early. Outcomes for stage 1 are dramatically different from stage 4, and the only variable separating those outcomes is what someone did in the weeks after their body first started signaling. Too many people wait. Too many call it aging. You still have that window, but it doesn't stay open indefinitely. Here's exactly what to do. Write down every symptom you recognized, when it started, how often it happens, and whether it's getting worse. Then call your doctor and read that list aloud, word for word. Don't summarize it as feeling off. Specific symptoms lead to specific tests. Vague complaints often get sent home with nothing. And if your doctor brushes off your concerns without ordering imaging, you're allowed to push back. Ask directly whether a CT scan or abdominal ultrasound is appropriate. You're not being difficult. You're the only person in that room whose job is to advocate for your own life. If this video told you something your doctor never has, please tap like. It helps put this information in front of another senior who needs it just as much as you did before pressing play. Subscribe if you haven't already. Every week, this channel covers the health information that rarely makes headlines but genuinely changes outcomes for people over 60. And share this tonight with someone whose back has been bothering them or who keeps insisting they're fine. You might think you're just forwarding a video. You could be handing them a window they didn't know they still had. There's one more thing I intentionally left out of this video because it deserves its own conversation. There's a specific combination of just 3 of these 8 symptoms that together doesn't just suggest pancreatic cancer, it almost confirms it. And there's a single test your doctor can order tomorrow that can catch this combination before it reaches stage 2. Almost nobody has heard of it, and almost no doctor mentions it unless asked by name. That's exactly what the next video covers.